Locate the patient's greater trochanter, align the center of the hinge at the hip, and have your patient hold the hinge in place. This allows them to feel the appropriate location for the hip plate. If needed, use bending irons to adapt the strut for necessary abduction or adduction angles, or adjust to the patient's leg shape for units without abduction hinge. Note, for units with abduction hinge, using the included Allen wrench, adjust the hinge from -10 to 20 degrees as desired. Device ships at 0 degrees. Adjust the length of the strut such that the distal thigh strap will not interfere with the popliteal region of the knee. Use the push buttons to adjust the length and click them into place. Position the lower thigh cuff in such a way that the bottom edge is located approximately 5 centimeters or 2 inches above the top of the patella. Note, on the shortest setting, both push buttons may need to be engaged to allow freedom of movement. Secure the thigh strap into the keyhole receiver on the distal thigh plate. If needed, adjust and/or trim the thigh strap to the appropriate length. Ensure the belt compression system is stretched to its full width before fitting. Position the belt with the pulley system at the patient's back and wrap the belt arms around the patient, covering the thigh pad on the device and securing in front. Make any adjustments necessary to keep the device in the correct position over the hip and aligned with the greater trochanter. Place position marker on belt to identify optimal alignment of belt and frame. Wrap the adjustable belt around the waist and insert the OsraFit tool. Adjust the length of the belt arms to position the tool centrally. Secure the belt ends to desired sizing. Note, if the patient's waist exceeds 127 centimeters or 50 inches, an optional belt extension can be added to the belt arms to reach a maximum belt circumference of 178 centimeters or 70 inches. Remove OsraFit tool from belt. Note, if an OsraFit tool is not available, lay the belt flat with overlap closures removed and compression system loosened. Fold each belt arm equally to achieve the desired waist circumference and secure the belt ends. Place belt ends into the overlap closures. Once belt ends are secured, the overlap closures will serve as belt ends. Note, to obtain the lowest profile fit, the belt ends can be trimmed if later adjustments are not required. Close belt securing the overlap closures. Lay down the left-hand belt arm first, followed by the right. Slide thumbs through the holes in the 2 compression system handles and pull until the belt is at the appropriate tightness. If the cords are too long, remove device from patient and reset the pulley system by pulling outward on belt. Using the quick release pegs, adjust the flexion extension stops to the desired range of motion and secure the pegs with a quarter turn twist until they lock back into position. For a left setting of the device, 90 degrees flexion or 0 degrees extension, place quick release pegs in hole marked L and hole marked 1 and 2 as shipped. 45 degrees flexion, place quick release peg in holes L, 2, and 4. For a right setting of the device, 90 degrees flexion or 0 degrees extension, place quick release pegs in hole marked R and hole marked 3 and 4 as shipped. 45 degrees flexion, place quick release peg in hole marked R, 1, and 3. Orientation adjustment. Note, while the device is available as a left or right orientation, it can be converted to the opposite orientation by reversing the left L or right R pegs at the base of the hip plate and readjusting the flexion extension stops for appropriate range of motion control. The device will be set at 90 degrees flexion and 0 degrees extension out of the box. Device removal. To remove the device, detach compression system handles slowly from the belt to loosen and reattach them to the sides of the adjustable belt. Detach the thigh strap. Detach the overlap closures and remove the device. Note, to ensure a proper fit, ensure the belt compression system is stretched to its full width before reapplying the device.